This is Allison Carroll
Jordan Hughes,
and Megan White.
and this is our final project presentation for Intro to Higher Education 510, Current Issues in College Student Health, History, Trends, and Future Challenges. This presentation will cover history, current issues, and future trends pertaining to mental, sexual, and nutritional health for the college-age student. How healthy were you in college?
Yeah, us too.
Staying healthy in college is a very difficult task. College is a time for students to explore life, get out into the world, and become independent. With this independence comes many challenges to staying healthy. We study college student health to address these barriers. Healthy college students are happy college students. Health is key and instrumental to a successful, happy, and healthy college experience. Health is a very hot topic on college campuses today as many students are struggling with various health issues. Health is of particular importance to college women, and universities can implement programming to help students make healthy decisions every day. In our presentation today, we will cover 3 areas of health: mental health, sexual health, and nutritional health. We will also go over guidelines for healthy campuses, future challenges and trends in college student health, and our individual recommendations for positive change in the health of college students. The first area of health we will cover is mental health. Mental illness is a rising issue of concern in college-age students. 50% receive no education on mental health issues prior to college, and 30% reported problems with schoolwork due to a mental health issue. These are just a few of the statistics that point to the rising presence of mental health issues on campuses. The National Alliance on Mental Health reports that colleges across the country have reported large increases in enrollment, and simultaneously, college counseling centers have also observed an increase in the prevalence and severity of mental health issues on campus. More importantly, there is an increase in the number of students taking psychotropic medications. The chart below from the Center for Collegiate Mental Health indicates this increase in mental health issues on campus. Mental health today is a huge concern on college campuses. 1 in 4 young adults between the ages of 18 and 24 have a diagnosable mental illness, and more than 25% of these students have been diagnosed or treated for these mental conditions. The most common diagnosis was depression, and most importantly, most students state that their college was not very supportive of their desire to seek treatment. This is a definite area of potential improvement for college campus administrations. The statistics on depression and suicide within the college-age student population are extremely alarming. Suicide rates among young adults aged 15 to 24 have tripled since 1950. Over 11% of college students have been diagnosed or treated for anxiety in the past year, and 10% have been diagnosed or treated for depression. Suicide is the second most common form of death among college students. Over 40% of college students report issues in dealing with stress management. More than 80% of college students feel overwhelmed by all they had to do in the past year, and 45% have even felt that things were hopeless, according to the National Alliance on Mental Health. The top 5 sources of stress for college-age students are the following: change in sleeping habits, vacations/breaks, changes in eating habits, increased workload, new responsibilities. Other notable sources of stress included pressure to find a life partner, job search prospects, and earning high grades. Of the college-age students, especially freshmen, were particularly vulnerable to stress due to their transitional nature of college. Mental health issues in college-age students have received notable attention in the last several years because of campus violence issues and school shootings. The notable school shootings within the last several decades are listed on the slide below. Mental health issues will continue to be a concern on college campuses over the next decade. Most importantly, students report that their colleges are not always supportive of their efforts to seek help for their mental health issues. Students need to feel that their campus administrators and counselors are approachable and supportive. We must work hard to reverse the stigma of mental illness so students feel comfortable reaching out for help. To address these concerns, partnerships have been formed between the APA, NASPA, and the American Council on Education. In addition, we believe that all university staff, not just counselors, should be trained to address mental health issues on college campuses.
In this portion, we will be discussing sexual health on the college campus. To better understand sexual health, we need to go back and review the history. In the early 1900s, America believed in the purity of women. Having a sexual appetite was considered bad if you were a woman. Men, on the other hand, not so much. Sex education during this time was focused on anti-masturbation and was heavy on purity. No sex before marriage, and sex was for making children and not pleasure. By the 1920s, the Victorian woman was disappearing. Sex among young people was growing and courtship was changing. The growth of this trend exploded during the 1960s and 70s, the time of free love. This was the birth of the sexual revolution. Birth control, drugs, and since this was during the Vietnam War, the slogan "Make Love, Not War" was front and center. This was seen the most on college campuses. The growing issues surrounding sexual wellness on college campuses have piqued the interest of researchers, resulting in the following statistics. In the U.S., more than 750 girls aged 15 to 19 become pregnant every year. More than 80% of these are unintended pregnancies. 2 young people ages 13 to 29 contract HIV every hour. Teens who receive a comprehensive education about sex are 50% less likely to have an unintended pregnancy than those who receive sex education that are abstinence-only or contraception-only programs. Emergency contraception and comprehensive sexual education have both proven to reduce the rate of unintended pregnancies. Emergency contraception prevented 51,000 abortions in 2000. 65% of LGBTQ middle and high school age students report having sexual harassed with sexual remarks or touching because of their orientation. Current issues in sexual health education on campus have risen questions about sex. Should sex education be taught in higher education? The answer should be yes, but there are those who oppose this because the content that would be presented, or taboo content. This can include abortion, masturbation, and the idea of having sex. But there are other important topics: sexual orientation issues, how to perform safe sex, responding to sexual assault. The list goes on. Some of the topics that today parents are trying to push on their students are the practice of abstinence and not protection. It is being taught that sex is bad, wait until marriage. Students are learning from TV and movies and friends. The pill is bad, encourages young people to have sex, and the topic of STIs. Sexual violence on campuses is another growing issue being seen around the nation. Looking at the statistics for Arizona State University, we can see that the percentage of sexual violence committed on male and female students can range from as low as 1% to as high as 5.9%. So what constitutes as sexual assault? Some examples are inappropriate touching, threats of rape, and even verbal abuse. And one thing that is seen, especially in freshman students, is the knowledge of the difference between a healthy and a non-healthy relationship. Knowing this knowledge is important to a healthy college experience. One thing that shows of healthy relationships is treat others as you want to be treated, hold yourself accountable for your actions, talking and listening. Seeing a non-healthy relationship, you see threats, controlling, intimidation, possessiveness, isolation, and humiliation. This chart shows the sexual violence statistics for colleges and universities in the state of Arizona. As we can see, sexual violence on campuses is an issue, something needs to be done to fix this problem. Due to the increased reports of sexual violence on campuses, President Obama presented the It's on Us campaign to fight sexual violence and educate administration and students about the seriousness of this issue. Public awareness campaign to help prevent campus sexual assault. This campaign was presented on January 2014 by President Obama and Vice President Biden, and it was established in the White House, and it established the White House Task Force. This task force identifies the scope of the problem through campus climate surveys, preventing campus assault and engaging men, helping schools respond effectively when a student is assaulted, improving and making more transparent the federal government's enforcement efforts, and some things that we can help to prevent this kind of issue on our campuses is we can encourage education and prevention programs, bring outside experts, training, resources made available for those who have been victims of sexual assault, and public awareness.
Now we are going to discuss the role of nutritional health and physical wellness in relation to colleges and universities. First, we will discuss the history and progression of health services in colleges, including some of the key events and policies that shaped college health and wellness. The notion of colleges providing health services primarily began in the 19th century, as campuses began to realize the importance of hygiene and physical education programs in universities. Being that many students lived on campus and spent a majority of time within close proximity of others, university administration determined a need for sanitary campuses to prevent the spread of disease. The federal government then began to catch on to the rise of health needs for college students in the early 1900s and further promoted health in colleges through the appropriation of funds towards colleges to fight venereal diseases. The era of the World Wars then ushered in the idea of sexual wellness, as previously mentioned in this presentation, and colleges began to discuss the social hygiene of students and how to handle the newfound promiscuity of students in relation to physical health. In the 1970s, the University of Denver became the first college to offer healthcare specifically for students, and the following 1960s and 70s faced the new challenge of providing healthcare to the large baby boomer generation. Continuing on with our timeline, the 1980s was a pivotal time for college healthcare as the HIV/AIDS virus takes America by storm. Colleges take a more preventive role in student health, as shown through the increase in preventive materials and publications provided to students regarding HIV and AIDS. The previously mentioned baby boomer generation also brought on an increase in college health centers' need to recognize the seriousness of somewhat risque health issues, such as unplanned pregnancies, drinking, and drug use. Health and physical wellness on college campuses continues to grow and react to health concerns of today's age. For example, the H1N1 global crisis caused colleges to reach out and protect their students that were studying abroad in infected areas of the world. The Affordable Care Act also created federal guidelines that result in better care for college students. In general, colleges have grown over the past decades to recognize the physical wellness of students as key factors in student success. One aspect of physical health of college students is obesity and weight gain while attending universities. We've all heard of the dreaded freshman 15, as students experience weight gain upon entry into universities. The phrase gaining the freshman 15 is often spoken to incoming students as a sort of joke. However, one study performed at the University of Oklahoma surveyed 137 college freshman females throughout their first year of college. Although the results did not exhibit an average 15-pound weight gain, the results do indicate an increase in overall body weight fat, and that the pounds gained usually stuck around even after college graduation. These students continued to gain weight at an average of 1.2 pounds per semester, which was likely due to the all-you-can-eat meal plan options and the typical party lifestyle experienced in college atmospheres. Here, you can see further details found from the University of Oklahoma study. For example, you can see that the BMI, also known as body mass index, increased over the year, as well as vigorous physical activity decreasing over the year. In general, it appears that the students in the study were becoming fatter and less active. Eating disorders are another area that is strongly related to college-age students. A study of eating disorders in college freshmen showed that eating disorders worsened over the course of a student's freshman year. The study mentioned that eating disorders are likely to start in college primarily due to high perceived stress as new students learn to balance academic, professional, and personal activities and responsibilities. Eating disorders are likely increased in college also due to a student's increased sense of ineffectiveness and general negative feelings about weight, perhaps due to weight gain as mentioned in the previous obesity study. Eating disorders of college-age students are also more common in women than in men, and common types of disorders are anorexia, bulimia, and binge eating disorder. Perhaps one of the main challenges of modern colleges in regards to eating disorders is that schools are now having to determine the best way to provide support to these students without crossing a line of inappropriateness. The final area of physical health that I will focus on is sleep deprivation in college students. The Center for Disease Control recommends that adults receive 7 to 9 hours of sleep per day to function optimally at jobs,